painkiller dependency trap, hidden damage from daily pain relief drugs. Relief drugs like ibuprofen, diclofenac, and naproxen are among the most commonly used medications for joint pain, arthritis, back pain, and muscle stiffness, and they often feel like a lifeline because they reduce pain quickly and restore comfort. But what most people never realize is that these drugs do not actually repair the underlying problem. They only block pain signals, while quietly changing blood flow patterns inside the body. Your kidneys, which act as your body's natural filtration system, depend on steady and healthy blood circulation to remove toxins and maintain internal balance. When these drugs are used repeatedly over months or years, they reduce protective blood flow to the kidneys, forcing them to work under stress. This damage happens slowly and silently, often without symptoms, until kidney function becomes dangerously weak. At the same time, these drugs weaken the stomach's natural protective barrier, making the stomach lining more vulnerable to acid damage, ulcers, and internal bleeding, which can appear suddenly without warning. Even more alarming, long-term use of these painkillers increases stress on the heart and blood vessels, raising the risk of heart attack, stroke, and circulation problems because these drugs interfere with the delicate balance that keeps blood vessels functioning safely. Many people believe they are protecting their body by controlling pain, but in reality, they may be slowly reducing the strength and resilience of critical organs that keep them alive and independent. The most dangerous part is that the relief creates a false sense of safety, while hidden damage continues quietly in the background. And this leads to an even more shocking reality. Many people who take additional drugs to protect their stomach from these painkillers may unknowingly be creating another layer of hidden internal risk. Acid reflux drug danger, stomach drugs that may weaken internal systems. Reflux drugs such as omeprazole, pantoprazole, and esomeprazole are often prescribed to relieve the burning discomfort of heartburn and GERD, and they can feel like a permanent solution because they quickly calm stomach irritation and protect the esophagus from acid damage. But what most people never realize is that stomach acid is not your enemy. It is one of your body's most important defense and absorption tools. Stomach acid helps break down food into usable nutrients, especially critical minerals like calcium, magnesium, and vitamin B12, which are essential for bone strength, nerve stability, and brain function. When these drugs suppress stomach acid for long periods, the body slowly loses its ability to absorb these protective nutrients properly. Over time, this can silently weaken bones, making them more fragile and increasing the risk of fractures, which can severely reduce mobility and independence. At the same time, the kidneys, which depend on balanced chemical filtration, may come under increased stress, raising the risk of chronic kidney disease without obvious warning signs. Even more concerning, the brain depends on certain nutrients that require stomach acid for absorption, and when this process is disrupted, it may contribute to memory problems, mental fatigue, and cognitive decline. The most dangerous part is that the relief from heartburn creates the illusion that the body is healing, while deeper biological systems may be losing strength quietly. Many people believe they are protecting their stomach, but they may unknowingly be weakening their bones, kidneys, and brain at the same time. And this reveals an even deeper truth. The drugs designed to protect one organ may be silently changing the stability of the entire body, which leads directly to another class of medications that millions rely on to protect their heart, but which may also carry hidden internal consequences. Cholesterol drug paradox, heart drugs that affect muscle and energy systems. Cholesterol-lowering drugs such as atorvastatin, rosuvastatin, and simvastatin are prescribed to reduce cardiovascular risk and protect against heart attacks and strokes. And for many people, they appear to be a life-saving shield because they lower cholesterol numbers on blood tests. But what most people never realize is that cholesterol is not just a dangerous substance. It is also a critical building block your body uses to maintain brain function, hormone production, and cellular stability. When these drugs reduce cholesterol production, they also influence deeper systems that depend on it. One of the first areas affected is the muscles. Many people begin to experience unexplained muscle weakness, stiffness, or fatigue because muscle cells depend on proper energy production to function efficiently. Deep inside the cells, structures called mitochondria act as energy generators, and cholesterol plays an indirect role in maintaining their stability. When this balance is disrupted, the body may produce less energy, leading to constant tiredness, reduced strength, and slower recovery after physical activity. At the same time, the liver, which is responsible for regulating cholesterol and filtering toxins, may show signs of stress, often reflected by elevated liver enzyme levels. This means the very organ responsible for protecting the body is being forced to work harder under chemical influence. The most dangerous part is that this process happens quietly. Many people blame aging for their fatigue, weakness, and loss of energy, without realizing that the internal energy systems may be under constant suppression. The protection these drugs offer to the heart is real and important, but the hidden trade-off may involve muscles, liver stability, and cellular energy itself. And this reveals an even deeper truth. The medications designed to protect survival may also influence how strong, energetic, and independent the body remains over time, which leads directly to another class of drugs that millions depend on every night, but which may quietly affect the brain itself. Sleep medication, brain suppression effect, sedatives that affect brain function. Problems can feel unbearable because when sleep disappears, energy disappears, clarity disappears, and even hope can begin to feel weaker. And this is why drugs like zolpidem, diazepam, and lorazepam are commonly prescribed to help initiate sleep and calm the nervous system. At first, these medications can feel like a miracle because they slow brain activity and allow the body to enter a sedated state that feels like rest. But what most people never realize is that sedation is not the same as natural sleep. Natural sleep is an active biological repair process where the brain restores memory, balances hormones, and repairs damaged cells, but sedative medications suppress brain activity instead of fully activating this repair cycle. Over time, the brain may begin to rely on the external chemical signal instead of maintaining its own natural sleep rhythm, which can weaken the nervous system's ability to regulate sleep independently. This can lead to memory problems, slower thinking, and reduced mental sharpness because the brain is not completing its full repair process. At the same time, these medications also affect the balance and coordination centers of the brain, increasing the risk of dizziness, falls, and physical injury, especially when the body wakes suddenly during the night. Many people begin to notice subtle signs like brain fog, confusion, or reduced alertness, but they often blame aging instead of recognizing the hidden neurological suppression happening quietly in the background. The most dangerous part is that the body may appear calm on the outside, while essential repair systems remain incomplete on the inside. Sleep may appear longer, but restoration may actually be weaker. And this reveals a deeper and more unsettling truth. The drugs designed to create rest may also influence how strongly the brain maintains clarity, balance, and independence over time, which leads directly to another category of medications that millions rely on daily, but which may quietly influence the heart, circulation, and overall energy itself. Blood pressure medication fatigue affect circulation drugs that affect energy health problem. High blood pressure forces your heart to work harder every second, and medications like metoprolol, atenolol, and propranolol are prescribed to protect the heart by slowing it down and reducing its workload, which can lower the risk of heart attacks and dangerous pressure spikes. At first, this protection seems beneficial and necessary, but what most people never realize is that these medications also reduce how strongly and quickly the heart can respond when your body needs more energy. Your heart is not just a pump for survival. It is a pump for strength, alertness, and stamina. Over time, this slowed heart response can quietly reduce oxygen delivery to your muscles and brain, and oxygen is the fuel that keeps your body energized and your mind sharp. Many people begin to feel constant tiredness, slower thinking, reduced physical endurance, and less motivation, and they assume it is simply aging, without realizing their circulation speed has been intentionally reduced. The hidden danger is not immediate damage, but gradual loss of performance, where the body becomes less responsive, less energetic, and less capable of handling stress. This creates a deeper realization that protecting blood pressure is important, but understanding how circulation affects energy and brain function may be even more critical for maintaining long-term strength and independence. Antidepressant adaptation effect, brain chemistry, altering drugs health problem, depression. Depression and anxiety can make everyday life feel heavier, and medications like sertraline, fluoxetine, and escitalopram are prescribed to help by increasing serotonin levels, a chemical that helps regulate mood, emotional stability, and mental calmness. In the beginning, these medications can bring relief, helping the brain feel more balanced and less overwhelmed. But what most people never realize is that the brain is designed to maintain its own chemical balance naturally, and when external chemicals continuously influence this system, the brain slowly begins to adapt. Over time, this adaptation can reduce the brain's natural ability to regulate emotions on its own, making it more dependent on the medication for stability. This can also affect the nervous system, which controls emotional responses, stress reactions, and mental resilience, and in some cases may influence hormonal balance, affecting sleep, energy, and overall vitality. Many people begin to notice emotional dullness, reduced motivation, slower mental sharpness, or a feeling of disconnection, without understanding that their brain chemistry has adjusted to long-term external regulation. The hidden danger is not immediate harm, but gradual dependence, where the brain becomes less flexible and less capable of restoring balance naturally, which raises an important question about how emotional health, brain chemistry, and long-term neurological independence can be protected together. Steroid exposure damage, anti-inflammatory drugs that affect multiple organs' health problem. Can make life painful and exhausting, especially in conditions like arthritis and autoimmune disorders, and drugs like prednisone, hydrocortisone, and dexamethasone are often prescribed to quickly suppress inflammation and provide relief. At first, these medications can feel life-changing, reducing swelling, easing pain, and restoring movement. But what most people never realize is that these drugs work by suppressing the immune system itself, which is the body's natural defense and repair mechanism. Over time, this suppression can weaken bones, making them thinner and more fragile, increasing the risk of fractures and loss of physical strength. At the same time, the immune system becomes less responsive, making the body more vulnerable to infections, slower healing, and reduced resilience. These drugs can also disrupt metabolism, causing weight gain, increased blood sugar levels, and added stress on vital organs like the pancreas and heart. The hidden danger is that while these medications reduce inflammation on the surface, they may also slowly reduce the body's natural ability to protect, repair, and maintain itself, creating a silent dependency on external control instead of internal strength. Understanding this balance is critical for protecting long-term health, independence, and biological resilience. If you found this information helpful, like and share this video so more people can protect their health and make informed decisions.